breast enlargements in some populations and some countries are of course very popular, and techniques have evolved a lot, especially in Europe. And to talk about it, we welcome now Dr. Constantin Stan. You're a plastic surgeon from Bucharest in Romania, and you have noticed that Europe was far ahead in comparison with the US.
Thanks God, I noticed, not only me, everybody noticed that, including our American friends, the doctors in the United States. Can you imagine? Now they are 20 years behind Europe. And because of our chance in Europe to work less with FDA moratorium imposed in 1991, when they decided to not use silicone breast implants. But fortunately here in Europe we had the chance to get back the silicone implants and to develop these devices for the breast woman improvement of the breast appearance, and also to develop new technique. I have some nice, if you want, comparison. Can you imagine, for example, American market accepting a model, let's say American model of a car, Ford, model 1991 up to until 2010? What happened in breast implants? It's amazing. They need to use the same breast implant 1992. Here in Europe, we had the chance to introduce the last generation of the breast implant who really changed the history of the breast augmentation. Because now we can, if you want, presented the breast implant history since 1964 when they introduced the first breast implant, okay? Like in ancient world, in breast implants, the second generation of stable silicone breast implants with something about a development of saline implants, which destroy a lot of American breast women more than silicone breast implants, who make a lot of American company bankrupt. And in Europe, we had the chance to develop the last generation of breast implants. And this is about what I like to talk.
So you have a new family implant which is called 4Two. Why this name and what is it exactly?
After 20 years, we just already get a new implant family because of the gel consistency. This is a new gel. If you want something unbreakable, undestroyable, no gel fracture, no lamination. And this means stability, safety, and breast control. And this is a very important issue. And also we have two gels inside. Diagon gel distribution, if you are looking here, you can see these two gels giving the same thing, stability and the safety. Everything for stability and the safety and natural-like feeling when you are touching this. When you're doing like this, any implant in the market, it's able to get back the shape without destroying and gel fracturing and lamination. And also the envelope adhesion to the gel. This gives also the opportunity to have a new design in two projection and two heights.
So let's try it now. Is it natural when you touch it? Yeah, well, it's a bit firm, but
yes, but firm means stable. Because naturalness is not only about the consistency; it's also on long-term stability and safety.
So usually with implants there can be, and sometimes there are some important complications, namely linked to breast augmentation techniques. So do you think your new technique that you call 4Two will solve these problems?
For sure will improve the outcomes and reduce the percentage of the complication and the outcomes, but will not solve the problem. When we are talking about multifactorial outcomes in breast implant is like that. It's a woman breast, the tissues, it's also the surgical skill and the surgical technique and the implant. An implant is only a part, but for sure this implant is simple, safer, because of the gel quality inside. It's actually, if you ask me only one word why it's special, it's the gel inside. You cannot broken this gel. It's impossible to laminate, to broken this gel. If you are squeezing, and I will show probably some samples, it's impossible to destroy it. This means safety and control of the breast shape.
And about the sensation when you touch it, do we really have the impression of touching a natural breast?
Yes, a natural breast are a very young woman, not a medium age or an old woman. That means if you are doing a breast augmentation or a breast reconstruction in a medium age or an old woman, you need first of all to reimagine what really means a real consistency of a young breast. This is why you put the woman to touch, for example, the buttocks. or the thighs, and you'll see the difference. This is why it's a natural-like. It's a sort of plasticity. When you're touching, it's not like elasticity of the classical breast implant, something like a gummy bear or jelly. It's something slowly going back. It's a plasticity, which is really the most important thing in the breast augmentation. Plasticity, consistency. You like very much this.
Okay, I will try it anyway, perhaps. But what is, according to you, the future of breast implants? Is it more and more natural breast implants, safer and safer ones, or perhaps other techniques like stem cells or fat cells, etc.?
Regarding the breast implants, for sure, the future of breast implant, it's more about not consistency in per se, like having something very soft. Soft is not every time natural. It's safety. On long term, the most important thing is safety. And safety means breast control tissues, and the implant must have a certain consistency of the silicone inside to have the minimum chance to broken, to have the capsular contracture, and to preserve the breast shape. Stability and the safety and the control of the breast. I say this is like a couple. If you have a woman and a man, both must be together. If someone is going around, you are losing the couple. It's the same thing in a breast. We have the breast implant, must be very stable to decide, to control, and the tissue of the woman. Tissue woman, it's very difficult to change it, but breast implant, it's in our hand. And it's a manufactured now task to help us and to work to improve this. What happened in fillers? Every time, every day we're hearing about new implant, new fillers. What about in breast implants? Because American companies are deciding when to change and to introduce a new one. And more than 20 years, we have nothing. And we've been obliged as a doctor to cover some implant problem with our surgical skill or surgical technique. This is why I developed a technique called multiplane technique to give a better coverage of the implant to control the breast stability. But now it's a company and manufacture time to help us.
Right, I think the message is clear. Thank you very much, Dr. Constantin Stein. I remind that you're a plastic surgeon from Romania in Bucharest. Thanks a lot.
Thank you very much.
Thank you.